Jeffrey, look, on the pharmaceutical, on the corporate side, one of the things the president tried to demonstrate last night is that all the players are coming to the party, and we need to do this now. Mm-hmm. How do the corporations feel about this? How do the healthcare providers, the pharmaceutical companies, what do they really think about this?
I think they're really concerned. I think they're very concerned for earnings, and I think they're very concerned for how it's going to impact their business going forward. They've set up their business to operate in one way, to be able to put products on the market that are better than other products, charge a premium for it, make a profit. Now, from doctors all the way to corporations, nobody knows whether they're going to have a plan that's viable, and no one knows what it's going to impact them on, but all of them are fearful that he's talking about cutting everywhere, and is it going to curtail their ability to make a living? And as a result, is it going to curtail their ability to provide a product that helps keep people alive and do the job they want to do?
You know, Ron, I was saying to you before, my husband's a small business owner, and he bid out his health care to 3 different companies, and the premiums were on average up closer to 30%. And the danger here, as far as I'm concerned, for small business owners like him, like you, is that, well, will you be incentivized to keep people full-time, or will you be incentivized to keep people part-time, and then you won't have to cover their health care benefits? And so in essence, what we might be doing is we might be creating a system where we're talking about 47 million, but that 47 million could go to 75 or 80 million if we don't do this the right way.
You're absolutely true. I mean, as I mentioned, if you think about what you currently pay, it's more like 12 to 17% of health care. Right now, if you walked into me with a House bill which says I only have to pay 8%, or the Senate bill which only says I have to pay $750 a year, I say I don't offer health care at all. I'm going to let the government pay for it. And so I'm paying 8% now, but the costs are still at that 15% level. If you can't dramatically reduce those costs and bring those down, there'll be a significant burden on the government, which means more taxes or higher deficits.
You know, a key thing, Anna, here, and you've written about this, I'm so glad, this is so important for people to understand, is what percentage insurance will be covered under these bills. You know, most healthcare insurance plans right now, they cover about 80 to 85%. But there's different metrics based on different bills, and you believe that could really impact the costs. Explain that to us. This is a very important part of this conversation.
There are a lot of moving parts in these bills that could affect consumers. What you're talking about is what they're going to mandate as the minimum benefit that everyone would have to have once there's a requirement that we all have health insurance. In the House bill, it's 70%, and what that means is, on average, your insurance would pick up 70% of the cost of your care, and you'd be paying 30%. The Senate Health Committee bill has a bottom number of 76%. That's lower than a lot of employer plans today. A typical employer plan, a PPO, has a level of about 80 to 84%. But it is higher than a lot of plans you can buy today on the individual market. And the richer the plan, the more the plan pays for, the less you pay out of your pocket. On the other hand, the richer the plan, the higher the premiums might be.
I was saying to you guys, Jeffrey, earlier that my husband said to me yesterday, we're out on our bike and we're riding, and he said, you know, if we show, yeah, be careful, right? If we show evidence that we're working out actively, our insurance company said they give us back $200 a month each if we prove that we're being healthy. Prevention, something the president has talked a lot about in the past. That's $4,800 a year for 2 of us. I mean, maybe we need to see more of that, and that prevention part of the equation here could actually drive down costs substantially for consumers. Had we not looked at that letter, we wouldn't have known.
People are looking at what the costs are in hospitals. Your key costs in hospitals are when you end up in the intensive care unit or the critical care unit. You've generally ended up there because of either a non-compliance to medication or something's really gone wrong in your body. If you could change people's habits, have them exercise. President Obama has talked about stopping smoking, working on obesity. There are many studies out there that have been shown from Harvard through insurance companies also that have shown if you can change your behavior, that's even more important than taking your medication. You might not need your medication if you can drop the weight, if you can not smoke. So insurance companies are very well aware of the fact that if they can make people healthier, help them be healthier, help them have healthier practices with regard to exercise and eating, they can lower the overall health care costs.
Hey, Craig, one of the interesting parts about this is it's suggested that they cannot, discriminate against anybody who has a pre-existing condition. They're going to have to take people, whether they have specific conditions or not. how much of that, I guess, is essential? Because, look, someone like you didn't have health insurance for 6 years, and you had to be very careful, very pragmatic about it.
Yeah. I mean, well, also, like, just, I was thinking about what he was saying about, you know, controlling obesity and smoking and everything. Just don't go to the emergency room. If you had the proper, you know, insurance, if you had a primary physician that would take your insurance, then you would go there and maybe get something, you know, handled directly, and you wouldn't have to, you know, be in that position to be charged. You know, like, emergency rooms are ridiculous. I cut my hand once, and I was paying 3 years for it, you know, doing the dishes, and couldn't afford a dishwasher.
Neither could any of us.
You know, this is New York City. Not many of us have it. You guys have dishwashers?
I didn't grow up with a dishwasher.
You
didn't have one for 25 years.
That's incredible.
This is why he's the comedian here.
The camera guy has a dishwasher? I think there's something wrong here.
All right, guys. Great conversation. I appreciate all of you joining us. Thanks.